now ask Mr. Makopole Moshia, who will speak on implementing the men that have sex with other men or lesbians, gay, bisexual, transgender, intersex program at the University of Limpopo, Lessons Learned. Over to you, sir.
Greetings to everyone. I'll be speaking on a program that we had at the university. To start, I would like to firstly explain what this program is all about. I understand that it wasn't practiced in all institutions of higher learning, especially in the TVETs. Now, the MSM-LGBTI community is one of the minority groups within our communities. This is basically an awareness program for key population, as according to the NSP, with the aim to increase access to healthcare, student services, and overall social justice in higher education. And these were implemented through advocacy, creating incubators of change, through investing in a peer education program and an LGBTI student organization. The intervention activities that we had in the institution, the University of Limpopo, are as follows. We had the empowerment groups. These are basically peer-led support groups whereby students within their own confines spaces, they would then engage on their experiences and encounters as LGBTI students, right? And then we had campus dialogues. The campus dialogues basically would go in this fashion. The students' population being anybody within the community being offered an opportunity to can engage and learn more about LGBTI issues. This is mostly presented by the LGBTI students themselves to educate their fellow students about what LGBTI issues are all about and what they entail. We also had sensitization workshops. This is where we get presenters whom are experts in the field of LGBTI issues to come and inform and educate the student community or the staff community at the university about LGBTI issues. Now, this is the one chance that we get to actually fight and destigmatize, our people through sensitization. We also have community outreach. This is whereby our LGBTI students, as within their organization, they go within their community to do basic outreach programs. Now, the difference this time around is because these outreach programs are done by the LGBTI students, we are now given the opportunity to can see that even our LGBTI students, they are humane just like any other person within the community. And just like any other person within the community, they care about their environment that they find themselves in. Then we have the student organization. Prior to this, we didn't have within the institution a student organization that was meant to cater for the needs of the LGBTI students. Through as one of the interventions, we then formulated an organization. We called it the UL Outreach Student Organization. And within that organization, we find that we can attract all other LGBTI students to form part of a community that they can easily identify with. Intervention activities that were meant for staff members include colleagues working together. From the office of the MSM and LGBTI office, we would then have collaborations with the other stakeholders within the university that engage on a daily basis with the students, from the housing community, the security, and all other facets of the university. We're speaking about your health and wellness and your counseling and development officers. We also have the HEAIDS committees within our institutions. These are the people that advocate and mobilize and resources to ensure that there are activities and interventions within our institution. The intervention reach. With all these interventions that I mentioned, this is what we managed as an institution to accomplish. We have, in the period of the 3 years that this program was implemented, we have over 1,300 MSM-LGBTI students attended that attended the peer-led support groups, which are the empowerment groups that I mentioned. Over 17,000 condoms and lubricants packs, and with IEC material within them that were distributed amongst the LGBTI students. We had over 1,200 general staff and students who were sensitized about MSM-LGBTI issues. Now, through this, you can understand that there's a shift in mindset from this result. We're having people now understanding or having more knowledge about the LGBTI issues. We also had a minimum, this is over a period of 3 years, a minimum of 60 MSM-LGBTI students that got tested for HIV annually. Now, the lessons learned from the implementation of this program, we basically learned that institutional buy-in has to be in the literal sense. You have institutions talking about how they want to transform. Only have this in terms of policies, and then we never see it on the ground, whereby students are actually engaged and there are intervention programs implemented. The other lesson is that LGBTI facets are beyond health issues. If you look into your own institutions, you will understand that most of the time when we get to hear about LGBTI issues, it's when there are health interventions involved. It's when we need the introduction of lubricants within our health systems. So we have, from the implementation of this program, we've got to understand that it is beyond health and wellness. There are other facets. We're speaking human rights. We're speaking, social justice. All these other things are not necessarily related to health, but we find that we only look at LGBTIs or consider the LGBTI community when we want to implement our health programs, but we can go beyond that. There's a high need to occupy spaces and create safe spaces. We have the issue on gender-inclusive bathrooms. This is something that is practical and can be achieved, and we see this being implemented at the University of the Free State. The other lesson would be that LGBTI issues, they are limited to the LGBTI youth community. We are failing to understand that even within the staff community, there are LGBTI community members there, and we need to source or start implementing interventions for the individuals. And then the other issue is on the human resource. We do not see the institutions or our institution in this regard, hiring and retaining members of the LGBTI community. The recommendations in this regard is the institutionalizing or institutionalization of interventions which are result-based, of course. For instance, the MSM-LGBTI program showed us that with certain interventions, we can get results that are positive. Now, if you have such a program, it is important that we keep it and we institutionalize it and make sure that it's formed part of our annual or our permanent program as an institution. Unlike a case of this program whereby it was funded externally through NACOSA, it was after that intervention we see that after that program or after that period of the funding, we now see a lag in terms of the interventions being supported. We need to increase research within this regard so that we can have better interventions and we can have creative methodologies of living within our communities. The last one will be the issue of policy writing and implementation. We need to strengthen the transformation offices within our institutions to ensure that LGBTI communities are basically catered for. Conclusion there, it will be that we realize that this program in particular, it frustrates the inclusion of the MSM and LGBTI community within the mainstream health program in our institution, and the last thing will be that there's a continuous need to educate both MSM and LGBTI community, including the heterosexual students, about safe anal sex, as this is one thing that is practiced by all and is a reason why we are having all of these interventions regarding LGBTI as high-risk population within the health sector. Thank you.
Okay, good afternoon, guys. I just want to thank all the presenters for nice presentations. My name is Makopole Aubrey. I'm from Provincial Department of Health. I'm responsible for key populations. The question is, I want to ask Mr. Moshia, I'm not sure whether I'm pronouncing your name
Moisha,
right.
yes?
Yes. He reported that out of 1,300 MSMs from the campus, but only 60 were unable to test for HIV. I just wanted to check with him, maybe were they able to check the reasons as to why only 60 out of 1,300? I know maybe they didn't, with the research, it wasn't included in the research part, but after seeing the results, were they able to say, what is it, why it's only 60 out of 1.3?
Thank you, that's a good question.
Yeah, that's fine. I'd like to thank the audience member for that question. The issue about the number of people that attended our other interventions versus the issue of the HCT uptake has always been, I think it was part of the reason why we had to have this intervention to begin with. But little did we know is there is going to be an issue of how do we can recruit and mobilize all the MSMs and LGBTI students. Now the issue is, how do we tell that the people that took up the services are MSM or part of the LGBTI community? For instance, I'm glad you're from the Department of Health. In our consent forms, is there a place where an individual can identify their sexual orientation, for instance, which is the only way, how we can tell that this individual is part of the LGBTI community. We had an intervention with that regard. We actually modified our consent forms, but then this was done at a later stage. Within the 3 years, this was done at a later stage after we realized that we need to be able to identify them. Yes, indeed, we did that. But then again, it is how the individuals respond to that question. As we are seated here, we all had different methods of getting people to identify as LGBTI individuals. And the other thing is, amongst the individuals, we still have individuals that are not sure. Remember, we can't out everyone, by asking them, indeed, are you, depending, because now the question is, are we going to judge at the way a person is dressed, and then we imply that they are part of the LGBTI community? So it is also upon them to disclose to us that I do take part in high-risk sex. I do belong to the LGBTI community. That's why there's a difference within the number of people that took part in our support groups or other interventions, whereby we could have easily gotten all of this information through a register, and as opposed to people that took up HCT, whereas our consent form wasn't speaking to identifying people's sexual orientation. I hope I answered that well. Thank you.